Our next bill is House File 2821, Rep. Sencer-Mura. That was a large one. All right, I move that House File 2821 be re-referred to the State and Local Government Finance and Policy. Rep. Sencer-Mura, please explain your bill.
Thank you, Madam Chair and committee members. It's always hard to follow someone that brought treats, but happy to be here today to talk about what I think is a really important bill that could really have major impacts on the way that we do our work here at the state legislature. So this bill is about creating a policy and procedure for racial equity impact notes at the state level, specifically for bills that deal with deed, economic development. These racial equity impact notes are used in a number of state legislatures around the country, and they give us information about how bills could impact different racial groups. Some bills that may seem on the surface to be having really positive effects, when you actually dig into the data, can have disparate effects on different racial groups. And additionally, racial equity impact notes would tell us, what would the economic benefit be to certain communities of doing a bill over not doing the bill. So kind of similar to how we have local impact notes or fiscal notes, these would be able to be requested for certain bills and would help legislators as they are doing the business of legislating. So a little bit of the history of the bill. This bill has been worked on at the Minnesota State Legislature for a number of years. And this is a more kind of narrow version of the bill than has been in the past. And I think while I think it would be really impactful to look at racial equity kind of across our work, this bill proposes to really just start with one state agency, one department, and look at the economic impacts of bills that fall under deeds purview. This comes out of a working group that was put together by the Center for the Economic Inclusion that included some legislative staff to really look at kind of how we could do these racial equity impact notes and how it would work at the state of Minnesota. So there is a report. I'm not sure if this got out, but maybe we can email it out after to the committee just to kind of share more about the work of that group and kind of what are some of the recommendations. To talk about why we need this bill, I know that oftentimes in committee, I think particularly as our legislature has diversified, as we have more representatives who represent communities of color, we sometimes feel like we don't have all the information that we need to make decisions about bills. And I think this will give us some shared information based on hard data. And so I think it will help us make more informed decisions. I think the kind of inclusion, the introduction of this bill today is a starting conversation. I know that we have had some initial conversations with various departments, and this would be a major change for kind of how we do business here. And so I look forward to starting the conversation today. I think there will be a fiscal note that will be coming, has been requested about kind of what would be the fiscal impact of this bill be, and I look forward to continue conversations with the departments and agencies and committee members about how we could make this a key part of our work. But I do want to now bring up some testifiers who I think can really speak to, from various community members, organizations, government partners, the need for this kind of work here at the legislature.
Thank you, Rep. Sencer-Mura. And we have the first testifier, and I do not want to kill your name. I'll just let you introduce yourself for the record and proceed. I don't want to sound ignorant, so I'll...
Madam Chair, members of the committee, I appreciate your sensitivity there. My name is Vajong Moore. I'm the Director of Racial and Health Equity Advocacy at Blue Cross and Blue Shield of Minnesota. We are the largest health plan in the state, covering over 2.5 million members and across all 87 counties. We also proudly sued the tobacco industry and championed universal meals last session, all in the name of advancing racial and health equity. From our experience and from the science, we see gross inequities across health issues from COVID-19 to diabetes, from cancer to mental health issues. And what we know very clearly is that many of these diseases are preventable. And according to the CDC and WHO, the World Health Organization, a health inequity is a difference in community health that is avoidable, preventable, and unjust. And so it's in that vein that we are here to support this bill to ensure that racial equity impacts and analysis are built into the front end of policymaking and creation, that it is not treated as an amenity, that it is essential to creating the common good. We feel that this will be a tool for early detection and prevention, just like a colonoscopy or any kind of screening in the medical field. We don't think this is a silver bullet by any means, but we feel that by seeding racial equity criterion into the policymaking process, we have a foothold to have more rigorous and ongoing deeper community engagement and a more equitable outcome. Lastly, I just want to make sure that you all understand that this certainly is a moral imperative for our state, but in partnership with the University of Minnesota, the School of Medicine, and the Humphrey School of Public Affairs, we partnered to commission a study on the cost of health inequities, and we saw that these inequities cost Minnesota $2.26 billion every year in lost wages, lost employment. And so it is very expensive for our state, and it is costing us lives. We urge you, we implore you to support this bill to make sure that Minnesota can become the epicenter for advancing racial and health equity. Thank you.
Thank you very much. And up next, we have Michael. Please introduce yourself for the record and proceed with your testimony.
Thank you, Madam Chair and members of the committee, for this opportunity to speak in support of racial equity impact notes. My name is Dr. Michael Aylward. I am a primary care physician at the Community University Healthcare Center, which is a federally qualified healthcare center in the Phillips neighborhood. Excuse me. I'm also a member of Minnesota Doctors for Health Equity, which is a statewide coalition of physicians and health professionals working towards health equity. So Minnesota has some of the best health outcomes in the country, but those outcomes are not distributed equally. Minnesota also has the largest health disparities in the country across a range of metrics, with Black, Indigenous, Latina, Asian, and other communities experiencing shorter lifespans and high rates of diabetes, heart disease, cancer, and chronic diseases when compared to white Minnesotans. These disparities exist because of social and legal structures that create and perpetuate them. I see patients throughout the lifespan, and part of my job is working with patients to prevent and mitigate these diseases, but I also see many patients who are suffering needlessly due to preventable conditions that arise from lack of housing, education, access to healthy food, access to transportation, availability of work, and other social determinants of health. In June of 2022, the State House approved a resolution that declared racism to be a public health crisis. Racial equity impact notes are an opportunity to make good on this promise and provide transparency and accountability to laws and policies. Systems are created by people who make decisions, like all of us in this room, and the solution to healthcare inequities is addressing the root causes of poor health. Assessing the racial impact of decisions allows for health and all policies that actually benefit everyone. It is impossible to go back in time, but imagine a world where we made decisions with consistent, just consideration of the consequences of these decisions. The crack cocaine epidemic could have been treated as the medical crisis it was. The criminal legal system could have considered mental health and addiction treatment all along. Medical assistance could be available to everyone who needs it. Highways could be built in ways that don't split neighborhoods and put people at risk for cardiovascular and lung disease. You have the opportunity to create a system that, moving forward, addresses these issues before they happen. Last week in clinic, I saw an Indigenous gentleman who's struggling with the death of multiple family members in his family, a late diagnosis of cancer, an untreated mental health condition, an opioid overdose. He was at risk of losing his housing and has continued to work and support his children and grandchildren who live with him. Without housing, he may lose his job. Without his job, he loses his insurance and the ability to take his medications. So too do all his children and grandchildren. This is the burden many Minnesotans live with daily. As policymakers, you have the opportunity to alleviate suffering by creating just, transparent, and accountable policies. Thank you.
Thank you. Our next testifier is Nicole. Please come to the testifying table, introduce yourself for the record, and proceed.
Thanks, Madam Chair and members of the committee. I am Nicole Donoso, policy organizer of Voices for Racial Justice. At my work, we believe that policy should be used as a transformational tool to invest in our communities, protect our rights, and bring our voices and expertise into the rooms of power. But too often, even well-intended policies result in racial disparities because potential impacts were not sufficiently considered in a bill passage and implementation. In 2015, Voices for Racial Justice had a gathering to discuss which policy efforts to include in the racial equity agenda of that year. At that meeting, someone from the partner organization explained their idea to move a bill to eliminate payday lending. Another organizer from the Black community expressed his deep concern of those loans being eliminated because many people in his community use those in moments of crisis. He, instead, advocated for putting caps on their interest rates. This was a moment where people with good intentions were proposing a policy that was not the one that the community needed at the time. That is why Voices for Racial Justice support House File 2821, as it will provide an assessment of the potential racial economic disparities that might be created or exacerbated by the legislation. We know that there is always concern about the capacity of any agency of doing these notes. We firmly believe that it's past the time for any of us to use this as an excuse. Last fall, we had a cohort of 10 community-based organizations to discuss how we could be better at conducting policy assessments to advance racial justice. We are building the capacity in our communities, and we urge you to do the same at the legislature. Finally, by supporting this bill, you will demonstrate your commitment to advancing racial justice in Minnesota and to make it a place for all communities to prosper and to live with dignity and joy.
Thank you. Our next testifier is Antonia. Please introduce yourself for the record and proceed with your testimony.
Thank you, Madam Chair, members of this committee. My name is Antonia Wilcoxon. I'm president of the Minnesota Public Health Association and also an independent consultant working on health inequities. We are reaching to you to convey the Minnesota Public Health Association unwavering endorsement of House File 2821. It is a crucial bill that seeks to create a framework for requesting a racial equity impact note for proposed legislation. The Minnesota Public Health Association is a volunteer-driven professional organization with 350 public health professional members throughout the state of Minnesota. Our mission is to create a healthier Minnesota through effective public health practice and engaged citizens. We are an active, independent voice for public health in the state. We are also an affiliate of the American Public Health Association, whose mission is to improve the health of the public and achieve equity in health status for all Americans. House File 2821 aligns directly with the Public Health Association endeavors to foster a healthier Minnesota by incorporating a process for a racial equity impact note into proposed legislation. Such a note is a systematic examination of how different racial and ethnic groups will likely be affected by a proposed action or decision. These notes are usually used to minimize unanticipated adverse consequences in a variety of contexts, including the analysis of proposed legislation, policies, institutional practices, programs, plans, and budgetary decisions. This provides an objective-based assessment to inform legislators and the public of potential racial economic disparities that may be exacerbated or created by proposed legislation. It can be a vital tool for preventing institutional racism, and for identifying new options to remedy long-standing inequities. House File 2821 has the capacity to enhance governance, foster economic stability, and make significant progress in promoting racial and health equity in the state by incorporating these notes in legislative process. We know, and we have repeated very often for decades now, that although Minnesota is one of the healthier states in the country, not all of our communities are afforded the same opportunities for health. This is a well-known dictum that we have been tired of repeating. I think this note provides a great opportunity for us to move the needle and to do something that is going to benefit the public good. Thank you.
Thank you. And our last testifier is Faith Jackson. Please introduce yourself for the record and proceed with your testimony.
Thank you. Madam Chair, committee members, my name is Faith Jackson. I'm the Chief Equity Inclusion Officer for the City of Bloomington. And today, in just 120 seconds, I plan to do 3 things. I will describe the value of racial equity impact assessments, the ability for them to be implemented effectively and practically, and also describe their impact. So to start, racial equity impact assessments are really just a planning tool. So like environmental health impact assessments or a workplace risk assessment, it really allows us to uncover any sort of potential adverse impacts in policy and decisions while we're still in that planning stage. They've been very impactful in the City of Bloomington. You have before you a letter of support from Councilmember Jenna Carter that describes that. I lift up one example for that, and that is amendments to the City of Bloomington's rental housing policy. In that process, staff discovered that many new Americans had varying relative structures, and that our code, which had very restrictive immediate family language, was disproportionately impacting BIPOC individuals. In modifying that structure, we were able to move away from restrictive language and really just focus on what mattered most, amount of people per square footage. And while that was helpful for those who had been disproportionately impacted, it was also really helpful for many of our senior residents who had children or grandchildren moving in to support them. And so now that I've talked about value and impact, you're probably asking, well, how do you make this work? Is it practical? The answer, it is. In Bloomington, I work closely with the staff who are completing impact assessments, both in gathering data and analyzing, and also in doing community engagement and gathering feedback. And so this makes the process both manageable for staff and also ensures the integrity of the process. So in short, racial equity impact assessments are valuable, they're impactful, and they're also practical. And then I end, in my last 30 seconds, on a personal note. As a Black woman, I know far too well the impacts and lasting effects of racialized policies and decisions. In fact, many people in my network today are grieving the loss of Jessica Petway, an influencer who died and was taken from us far too soon after being misdiagnosed several times. And while I distinctly understand the difference between crafting policy and providing direct health care, it's not lost on me the impact of the social determinants of health, things like employment, housing, and economic development. These things have a very real and tangible impact on individual public health outcomes. And so I see racial equity impact assessments as an opportunity to do real and great important work and help create a more impactful and valuable and inclusive community for all. Thank you for your time.
Thank you. I believe we have an amendment, the A1 amendment. Lead Kosnick, you have that?
Thank you, Madam Chair. I would move the H2821 A1 amendment.
Okay. Can you explain your amendment?
Yes, Madam Chair and committee members. What the amendment does is removes lines 2.7 to 2.15. In that, it suggests that the LBO take a look at a variety of different data centers in here, but it's not fully encompassing of the talents and abilities of the Legislative Budget Office to fully analyze and I think it's kind of restrictive to list, just kind of a handful of data points. In fact, one of them on line 2.13 is the Johns Hopkins Coronavirus Resource Center. And looking at their website, I don't know if the author is aware that Johns Hopkins has stopped collecting data as of March 10th, 2023. So to illustrate, putting this in language is already outdated and irrelevant, but the LBO certainly, in providing these notes, could find any data that they feel relevant, and so you're kind of limiting, even though it may be permissive language. I don't know that it fulfills the whole intent. There could be other data points that are more relevant, determining on whatever the particular file might be, and so I think it actually limits by putting it in language of what they may or may not look for, and so. That's one thing. The other, one is the Kaiser Health Family Foundation on health disparities and summaries on that, dealing with health. Is this bill going, Madam Chair, my understanding, back to state government, or are we going to
Going to state government.
Okay, well, let's just take up the deletion and kind of handicapping and pigeonholing the Legislative Budget Office to these data centers. So I think it would be, allow it to more broad discretion if we remove those data points on there. So I would encourage members to delete those out of there and give the LBO a little bit more discretion.
Discussion on the amendment. Rep. Katisutun.
Thank you, Madam Chair. And Representative Koznick, I understand your concern with, the LBO starting with a certain number of sources, but the language seems to be clear to me in line 2.8 that it's including but not limited to. And I think sometimes when we, if you have suggestions of other things that maybe Representative Sencer-Mura could add to this section, I think that it's intended to be a well-rounded breadth of information and different sources that they can consult with and then go above and beyond that should they need to utilize other sources. But I don't really see why we would delete suggested starting places that include things like the United States Census Bureau and some of the most well-known, our very own DEED data center, the Minnesota Compass data. These things seem like they're pretty objective and nonpartisan reference sources, and I think that's probably a good thing for the LBO to start there and then move beyond.
Kosnick.
Madam Chair, thank you. I'd be curious what the author's thoughts are on this, but since I have the floor, I would just say I don't believe that currently with LBO with fiscal notes that we say you have to look at this and specific data points on that and cert calculations. It's we don't know what the future legislation proposed may be, and so basically we're steering and the LBO and like I said, kind of predetermining data that they use, and so taking it out just makes it more permissive to use their discretion. And if this was to pass, the authors may work with the LBO and on their intent and say maybe this is areas that you might want to look at for reasoning and data. But putting it in here very clearly steers the LBO, and I don't know if they plan on testifying here, but maybe at the next stop. And so that's my intention. I'd be curious what the author's comments would be.
And I believe the LBO is here. It's my understanding, but Rep. Sencer-Mura.
Yeah, and if the committee would like to hear from the LBO, I'm open to that. I would say I appreciate the conversation, Representative Koznick, but I would agree with Representative Katiza-Watun. It's permissive language, and I think when we are asking, and I'm sure you as a more seasoned legislator have experienced this, I think when we are asking our agencies to do something new, oftentimes they want to have a better understanding of the legislative intent and want us to kind of provide as much information as possible. These sources came out of work from this working group that was put together that included an LBO representative to kind of help craft what this legislation could look like. I think these are all trusted sources, and I think having that starting point, especially for kind of a new concept for our legislature, is really important. But I would be willing to work with you on if there are additional sources that you would want to see in here. I think, we want to make sure that when we have these notes, they are looked at as neutral. I think that's really important to get bipartisan buy-in on this. So I would love to work with you to continue to think about what sources could be included in this list.
All right. Are we good?
I've said enough.
Okay. All right. Let's take a vote on this. All those in favor of adopting the A1 amendment, say aye. Aye. All those opposed, say nay.
Nay.
No. All right,
Or,
the
yeah,
amendment
aye.
fails.
Koznick votes aye.
All right, the
it
amendment
wasn't a roll.
fails.
I thought we convinced you, Representative Koznick.
Discussion on the bill.
Madam Chair,
Yes.
I'm sorry, I didn't mean to jump ahead.
No, we can start with you. That's fine, Lead Councilor. Go ahead.
Madam Chair, one of the items spoken quite extensively on in the public testimony, but also within the document, like I mentioned, the Kaiser Family Foundation, the health disparity parts. I would move that we refer this bill to the Health, Finance, and Policy Committee to have them more closely look at that and see if there's any concerns or suggestions from that committee, and I would request a roll call.
Roll call has been requested. Roll call is granted. I believe the bill is going to State Gov, and after that, I don't know what the pathway is. Representative Sencer-Mura, do you know where it's going after that?
Thank you, Madam Chair. I do not believe that it is planned to have a stop in the Health Committee. I know that members talked today about health. I think something that we've talked about at the legislature is the connection between health and wealth. Health is wealth, wealth is health. So I think it's important to have a broad understanding of how economic choices and economic development impacts people's health, community health, but I do not believe that this bill needs a stop in the Health Committee.
All right, we're going to vote on the motion to send this bill to Health, and a roll call has been requested. And I am agreeing with the author that this bill does not need to go to Health. We will take the roll.
Chair Hassan?
No.
Hassan, no. Vice Chair Hansen?
No.
Vice Chair Hansen, no. Lead Koznick?
Yes.
Lead Koznick, yes. Rep Feist?
No.
Rep Feist, no. Rep Igo?
It's not here.
Excused. Rep Katiza Batoon?
No.
Rep Katiza Batoon, no. Rep Kozlowski?
No.
Rep Kozlowski, no. Rep Perryman?
Rep Berryman. Yes. Okay.
Rep Perryman, yes. Rep Ryer?
No.
Rep Ryer, no. Rep Schumacher?
Schumacher, aye.
Rep Schumacher, yes. Rep Smith?
No.
Rep Smith, no. Rep Zhang?
No.
Rep Zhang, no. Rep Wiener, excused. The roll is closed.
With 8 noes and 3 ayes, the motion does not prevail. Discussion on the bill, Rep. Katiza Batoon.
Thank you, Madam Chair. And we can confer with House Research on this, but in the previous discussion about Representative Koznick's amendment, I did notice that in line 2.13, schools referred to as John Hopkins Coronavirus Resource Center, and I believe the correction should be Johns Hopkins, just adding an S to John in 2.13. So maybe a potential or amendment that we could fix, or that Representative Sencer-Mura could take forward to the next committee. Just wanted to point that out.
Is that something we can do?
Madam Chair, I can follow up with Representative Sencer-Mura on that.
Okay. All right.
Can I continue?
Yes,
comment?
go ahead.
Thank you, Madam Chair. I think that this is such an interesting proposal, Representative Sencer-Mura, and I know that you are not the first representative to work on this, and these are really important conversations. I think that, when we consider the history of not only Minnesota, but of the whole country, it being Women's History Month after all, that if people, a variety of people were in positions of power from the start of this country, women wouldn't have had to wait so many years to vote. People of color wouldn't have had to wait so many years for the right to vote. When we are in positions of power, we can help set the agenda and make the future a better place. So I'm thrilled and I'm honored to be serving with a diverse body in the House, but also in the Senate here in Minnesota. And we're starting to look a lot more like the state of Minnesota. And so when we look at objective data that is going to help us do better in the future, I think that's only going to bring good things. If we keep doing the same thing over and over again and expecting things to change, that's the definition of insanity. So I really appreciate you bringing this forward and continuing conversations with a variety of stakeholders. And I think that this could be really crucial in shaping the future work of the legislature.
All right, Rep. Feist.
Thank you, Madam Chair. Thank you so much, Rep. Sencer-Mura, for bringing this bill. It's been a concept that I've been really interested in. And the reason I love it so much is that we come into this body and we have this idea that we want to transform things. We want justice. We want really big goals. And I'm a fan of concrete, measurable action items. And I feel like this is that. It's taking, we heard people talk about how this is systemic, how this is objective. And I just really love how we're saying this is one very methodical way that we can build into our legislative process to get us from here to where we want to get, which is a more just, equitable Minnesota. So thank you so much.
Thank you. Rep. Perryman.
Thank you, Chair. Rep. Mine are a little more comments about what we talked about the list earlier. There's a great extensive list set forth, and I understand why you have a list. But if you can consider also other outsources, and I know you will, but like and I have a list here of the Cato Institute, Heritage Foundation, the Center for American Experiment. Maybe they're not all the right places to go and get some information, but I just would love to expand the list more and see more of a wide variety than what you have. So just a typical comment, and ask for your help in that, and if you have any questions, love to just give you a whole list, and then you can pick and choose. Thank you.
Representative Sencer-Mura, closing comments on the bill.
Yeah, thank you so much for the conversation, and I look forward to continued conversation. I think when we know better, we do better, and I know that all of us are very invested in doing the best job that we can with the time that we are here in the legislature representing Minnesotans, and I believe that more data will help us make better decisions. And I will say, I think I'm looking forward to continued conversations with agencies and departments about how we can do this and how we can build our capacity, build our muscles around racial equity. But I will say that a number of other states have been able to implement this, and I know with the amazing folks that we have working at the state of Minnesota that we will be able to do it too. So thank you, and I look forward to sending this bill on to state and local government.
Thank you, Rep. Sencer-Mura. I renew my motion to send the House file, to re-refer House File 2821 to the State and Local Government Finance and Policy. All those in favor say aye. Aye. All those opposed say nay. No. Motion prevails and your bill is on its way. All right.